The ulnar nerve can become injured on somebody from repetitive strain or overusage, or even just acute trauma or crush injury or an injury to the neck. Anywhere along the line from, this is going to be the ulnar nerve, this yellow band. So anywhere along the line from where it comes out of the neck, down the arm, behind the elbow, through the flexor carpi ulnaris and down to these fourth and fifth digits. So when you're looking at somebody who's got pain or weakness or tingling in this area, you want to look at the ulnar nerve. And we utilize active release techniques down here. It's a soft tissue mobilization for breaking up any restrictions or any adhesions in the soft tissues where this ulnar nerve may be getting hung up on. Once you clear that out, then you can give the person some flossing or some stretching, nerve flossing exercises for this. So what we're going to do is, you can see the nerve is at its shortened position, and as we bring the hand, the elbow into this position, you can see how that nerve lengthens, and additionally how we get it to lengthen more, pull these fingers back and twist inwards towards me like this. So that's going to put the most distal tension, most stretched position on the ulnar nerve. And you want to do this slowly. Let me remove the band so you can see. But if we start like this, the nerve is short because it comes behind the elbow. It's not in the front. So this, if it was short here, if it was in front, we would shorten it like this. But since it's on the back side of the elbow, we shorten it like this and bring the wrist up so you can see how this is approximated. To stretch that, we're going to do this. You can grab these two fingers and pull, and I'm going to do it on the side so you can see, but here, and then by pulling the fingers in this way, I'm really getting the ulnar nerve to lengthen. You'll see this a lot with people who are at the computer when the arm is resting on the desk. You'll get this compression where it feels like the nerve is getting irritated just from the weight of the arm sitting on the computer, working the mouse pad and all that kind of movement. Also with cyclists and handlebars, so handlebar palsy where you can compress the ulnar nerve down here at the tunnel of Guillain. So that's another area you want to check. So anywhere from the neck where the ulnar nerve starts, comes down through the arm, behind the elbow, as I mentioned, through the flexor carpi ulnaris, all the way to this little bone in the hand, where the tunnel of Guillain is at the hook of the hamate. Just some landmarks that they don't really matter, but just so you know that from here to here, you can have symptoms along here. You can have dysfunction, you can have nerve numbness, tingling, any nerve symptoms. So if you need to get the manual therapy, any sort of manual therapy is effective getting in there. We utilize active release techniques because we can feel what's happening with the tissue as we're moving it. And then trying that exercise again with, so you can see the nerve, like I showed this here, the shortening of it and pulling the nerve through the tissues and accentuating it with this deviation of the wrist inward.